The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Almost 1.5 million people live in Peel Region, just west of Ontario's capital city. They may not for much longer. Tonight we hear from Mississauga, Brampton and Caledon on the seemingly imminent municipal breakup and who owes what to whom. Then we'll hear why expanding the role of midwives in Ontario could help expectant mothers and the healthcare system more broadly. It's Wednesday, May 17th, and that's next on the agenda. Almost 50 years ago, Premier Bill Davis's government created the Region of Peel to facilitate the delivery of municipal services in the increasingly urban areas of Mississauga, Brampton and Caledon. Now, with all three thriving in their own right, and amid nearly 2 decades of pressure for Mississauga to become a standalone municipality, the region could be on the cusp of a divorce. With us now for more, here's Patrick Brown, he's the Mayor of Brampton. Annette Groves is the Mayor of Caledon. And Mississauga City Councillor Alvin Tejo is here as well. And just before we begin, I always do this in the interest of full disclosure. When Patrick Brown is on the program, I want to remind everybody that my wife was a health policy advisor to Mayor Brown 8 years ago when he was the Ontario PC Party leader. And she also ghost-wrote his memoir 5 years ago. On the record now. And with all that, welcome everybody. It's great to have you all here.
Thank you.
I don't want to assume that everybody understands how this works. I know you've had regional government in Peel for 50 years, but you know, we got a lot of new Canadians watching this program and they may not know how this works. Local council versus regional council, who does what? Mayor Brown, can you just start by explaining how does this all work together?
Well, this is the legacy of Ontario's greatest public servant, former Premier Bill Davis, who was passionate about Peel Region. And he felt at the time that you could pool resources to provide key services rather than have 3 water treatment plants and to have 3 police forces and 3 paramedic services, that we could pool resources together to provide that service for residents. And that's what we've been doing since 1974.
How well do you think it has worked in those years?
So listen, I think there are challenges, but at the same time, there's strengths. Obviously, on our own, it would have been very difficult to build the water treatment capacity. But when I look at the strength of the Peel Police, when I look at the strength of you know, the paramedics, I think, you know, having that regional body has worked. But I look at planning. I think it's a disaster having planning at a regional level and a local level because it slows everything up. And so, you know, I see the good and the bad. And I think it's important to look at it from that big picture.
Why does Mississauga want a divorce?
Well, I think it's time, Steve. Quite frankly, we have other municipalities that are considerably smaller than Mississauga. You're looking at Windsor, London, Guelph, Kingston, even North Bay are single-tier municipalities without a regional government on top of them to duplicate some of those things. And when we're talking about duplication, this premier likes to talk about there's one taxpayer and we want to cut red tape. And duplication right now is the biggest challenge that we have at the Region of Peel. We've got planning, 2 planning departments. We've got 2 works departments. We have regional roads and municipal roads. We have 2 legal services, and we have 2 back office and supports for the corporations. That's a lot of duplication and red tape that we can move on from. And so we want to pass that savings on to the taxpayers, onto Mississauga, Brampton and Caledon residents, to make sure that residents are getting the best deal for them. And we want to move quicker. We want to be more nimble. These are the types of things that you can do as a single-tier municipality. But to Mayor Brown's point, there are still some cost savings to be had with economies of scale. And those things we want to continue. You can have wastewater and water together as a public utility, the way we do with Electra and our energy. You can also have Peel Police continue to do their services as a sort of regional police force and have a pay fee system that's more fair for residents.
We'll get into this more as we continue our discussion. The parents want a divorce, Mayor of Caledon. The kid is always the collateral damage in a divorce. So what's happening with Caledon if Peel splits up?
Well, Caledon has always taken a position. We've been through this. This is our third time now going through the whole idea of separation. We've always maintained that we feel strongly that the region of Peel works well for Caledon. Given the fact that Mayor Brown has talked about the duplication, and I agree with the planning, and I know the Premier has changed that, and they've looked at that. But our position in Caledon is that the region has worked well. It has served the town of Caledon very well.
So you want to leave it as is?
That is our position, is that we leave Peel the way it is. It's worked well for us. And as you know, we are scheduled to take a significant amount of greenfield development. And so, you know, we're just growing up now. Mississauga and Brampton, they've grown up, and we are at that point where we're scheduled to take a lot of greenfield development where we're going to need the support of infrastructure.
So just so I'm clear, you like the region of Peel. I mean, you tinker, but it's okay. You like it the way it is. You want a divorce. You want a divorce as well? Brampton wants out too?
So what our position has been, if Mississauga insists on a divorce, then they have to pay the bill. And what the bill is our servicing capacity is already at capacity. We've had 4 housing projects turned down because of a lack of servicing just in recent weeks. To rebuild that servicing capacity is extraordinarily expensive. And so when we built it 50 years ago, you know, the cost of infrastructure was very different. And Mississauga's used up that servicing capacity. There is no vacant land in Mississauga. They've used it up. And now was the time for Mississauga to pay for new servicing capacity, a new police facility in Brampton, new servicing capacity in Caledon. And just when they're on the hook to pay for this, they're saying, we're going to leave. Good news, the Premier has assured me Mississauga will not be able to run away on their bill.
What's the bill, do you think?
Well,
how much?
To rebuild, to have servicing capacity.
Calm down, Alvin. I will get to you in a second.
According to the consultants that the City of Brampton is engaged, the water capacity, the water treatment would be $1 billion. The wastewater would be $3 billion. It'd be $4 billion. Just for Brampton alone, that's not including Caledon. Historically, we've paid a 40% share of the cost of new infrastructure. We paid a 40% cost for the 2 facilities in Mississauga. And the expectation is that Mississauga was going to pay for their share in Brampton. We're talking about, this is a huge, you know.
Multiple billions of dollars. And you want him to write a check for that?
Well, legally, they're obligated to.
Okay, let's find out over here. Do you think you owe them some money?
So I don't dispute Mayor Brown's numbers at all. I mean, absolutely, the city of Brampton has contributed 40% of all regional infrastructure for the last 50 years. But conversely, Mississauga has contributed 60% and has paid the freight for the region of Peel for the last 50 years as well, right? So, you know, we can go into a negotiation and understand that there are services that support everybody and that we are going to continue to use those services, and we can have cost share agreements. We already do this with York Region, where we provide them water and wastewater services at a fee that is fair, cost recovery, and done with supervision.
But the issue there
we can continue
the issue
doing.
there is that it's used up. You've built up Mississauga. You've used up the servicing capacity. When it's time to build this in Brampton, that's when you're running away on the bill. It's like ordering dinner, eating your meal, and then running away. And so, you know, Steve, my issue is the infrastructure that Alvin's talking about, and I wish Mayor Crombie would be here to speak to it, but the infrastructure that he's talking about is in Mississauga. We built the 2 water treatment plants in Mississauga. The police headquarters is in Mississauga. The infrastructure that Mississauga has paid 60% of, that's in Brampton, are archives we no longer need. The Peel Regional Council chambers we no longer need. That is useless infrastructure that can be
Mayor
sold
Brown,
off.
that's not fair. I mean, we're also paying for roads. We're also paying for all the services for the last 50 years, and this is going to continue to happen. We're going to do this in a service agreement, right?
The council chambers are no longer necessary.
No one is out to gouge anyone else, and no one's out to leave the taxpayer on the hook here for Brampton or Mississauga or Caledon.
Can I just ask you, did you pay in any of this stuff?
Yes, we paid 5%.
Paid 5%.
We did pay 5%, and as again, we are the smaller of the 3 municipalities, but we did pay our share. And really, when we looked at this, the last time we looked at this, we determined that when we look at Brampton and Mississauga, the services that they use in social services, Caledon doesn't need that. Caledon does not use that much in the social services cost. Now we do have regional roads that we have in Caledon. We've got 12 regional roads, but it was basically a wash. It was a wash because more social services are used in Brampton and Mississauga as opposed to Caledon. So at that point in time, when we looked at the whole regional governance issue and whether or not we should stay the way we are, and we determined that it was best to stay the way we are.
I'm sure you guys have all done polling on this stuff.
Yes.
We got a little bit of polling here too. In 2019, when the province was reviewing the region, there was some polling done on what people think by Main Street Research. In Mississauga, almost half the people supported separation. About a third wanted to stick with the region. 18% supported a new super city of Peel. In Brampton, about 2/3 wanted things left the way it is with the region of Peel. Only 8% wanted to separate, and 25% wanted a super city of Peel to amalgamate. In Caledon, 64% preferred the status quo, 20% wanted to separate, and 17% supported amalgamation. And across the region, only 30% of those surveyed supported dissolution, while half want to keep the region, and 21% wanted a super city of Peel. Premier Ford said earlier this week, for the first time, he went on the record and said he has always been in favor of Mississauga having the right to stand on its own 2 feet and have its own way. I didn't know that. Did that come as news to you, incidentally? Because I don't think he said that publicly before.
So, he has said before that cities as large as Brampton and Mississauga could stand on their own feet. But in the same press conference he had last week in Brampton, he said that the cost associated with this that would not be left on Brampton's doorstep, and that's a very important principle.
He promised to make you whole, I think, is the way he said it.
Otherwise, it's theft from Brampton residents. We have paid into that infrastructure over 50 years.
Now, you've been campaigning, not you personally, but your city has been campaigning to become the independent Republic of Mississauga for
since 2005.
Yeah, I was going to say it's 20 years, and yet half the people are only half the people are on side. Are you sure that you are doing what your ratepayers want you to do?
Absolutely. In 2005, when then Mayor McCallion took this to city residents, there was a campaign. It came back 99% in support from residents, sent the city the message that they want to separate and that this would be better for Mississauga residents because the numbers add up that Mississauga residents have been over-contributing to the region and have been subsidizing the other cities. And when you talk about a police model where we're losing or paying more than our fair share,
but that's
where a lot of the savings comes in for the city of Mississauga. But to the mayor's point, the province is talking about making everybody whole to make sure that no one is going to be left out on the
I want to speak to the police point because Mayor Crombie brought up some magical figures she picked out of thin air the other day.
We should say she was invited to be here today. Her schedule wouldn't permit.
But I understand why she wouldn't want to delve into these facts. Facts get in the way with the messaging sometimes. Chief Nish has put on the Peel Region website the calls for service. There is no Mississauga subsidy of Brampton. There's more calls on a per capita basis in Mississauga. There's more auto thefts on a per capita basis in Mississauga. There is no subsidy. That's on the Peel Region Police website. It's on right now the funding allocations on a per capita basis. So when you pick up a figure, and it may sound good, it's important that it's rooted in facts, and that's an example of a statistic that's been used by your mayor that is factually incorrect, according to our chief of police, Nishan Dirapa, who is incredibly transparent and incredibly accurate with his details.
Right, and we can talk about whether or not we want to pay based on our user fee or based on the assessment, but we also know that the numbers have been shown over the last 2 studies from Ernst & Young that Mississauga would have a significant amount of savings, up to $1 billion
That's not what
over
Deloitte
the next
said.
10 years. But the Deloitte study wasn't supported. It wasn't supported by the 4 municipalities, including the region. It was not.
Let me jump in for a second.
The Region
here.
of Peel issued that study.
But it was not supported by the council, the regional council, or the municipalities.
It was.
Whereas the Ernst & Young study was done by the 4 CAOs of the lower tier municipalities.
Brampton
and
and
the
Caledon
region.
never supported that.
Okay.
We supported
If
the
I may,
Deloitte
though, gentlemen,
study.
if I may, I think the people watching this are more concerned about if Peel dissolves and if police headquarters is in Mississauga, how do people in Brampton have their police calls answered? What happens there?
We wouldn't accept a police headquarters in a different municipality.
So would you have to build your own police headquarters in Brampton?
And Mississauga would have to pay their share of doing so.
You couldn't just simply say the police headquarters can remain in Mississauga and we'll contract services
Steve,
from them.
We just approved at Regional Council a year ago to build a new facility in Brampton. They've already picked the site. They're doing the initial work. And all of a sudden, Mississauga is saying, oh, shoot, we got a big bill to pay for water treatment. We got a big bill to pay for headquarters. Alvin, you voted for the new police headquarters. You voted for it.
We
and
can
now you
have
don't
a
want to pay
shared
for it?
police service. It doesn't matter where the headquarters is. I mean, frankly, it's on the border, right? It's just south of Steeles.
So you don't mind if we put it in Brampton?
If you want to build, we can build it together, right? I mean, that's the idea, is that we're sharing the services where there's cost efficiency to be found. And that is especially found in policing and water and wastewater.
And now do you understand why 50% said no, just leave Peel the way it is, or an overwhelming majority of my residents are saying leave it the way it is. It has worked well. It has served us well. It has served the community well. And quite frankly, Caledon has never asked for separation. We have never been in favor of separation. We just want to make sure, and as Mayor Brown said, fair share. And divorces are very expensive. We have a $36 billion corporation at the Region of Peel. And when we're talking about shared police services, we have our own police service. We've got OPP, but we have health services. We've got social services. We've got affordable housing. We've got supportive housing. We have so many other things to consider. And right now, I will tell you, we're in trouble with providing affordable housing and supportive housing for many of our residents who are homeless.
But let's talk political reality here. The political reality is the Premier came out the other day and said, this is going to happen.
Absolutely.
So status quo is not an option anymore.
No, it's
not. So you
not.
guys have to figure out what your future is.
That's right.
How do you see it?
Well, I have every confidence in the Premier, and I met with the Premier a couple weeks ago and spoke about should this happen and what would happen to Caledon. I can tell you that my conversations with the Premier has been extremely positive.
What did he tell you?
Not to mention we have the Deputy Premier in our riding, Sylvia Jones.
She's your MPP,
and Sylvia
isn't she?
is our MPP, and Sylvia understands Caledon. She understands the needs of Caledon. She understands our residents, and she is certainly supported and respected by the Premier. So she's great to have in our corner, and the Premier was quite...
What did he tell you?
Well, I'm not going to throw the Premier under the bus. But I can tell you this, that leaving that meeting, I was very confident that we had a partner in the province of Ontario. He understands that it's Caledon's turn to grow, and that we have a lot of needs in terms of infrastructure, and not just water and wastewater, but we've got to build communities. And in order to build the 13,000 housing units by 2031, he definitely knows that we need support from the province. And through this audit and this review, I am confident that Caledon will be looked after.
Okay, in which case I want to pick that up with Mayor Brown, because when the Premier says, don't worry, Brampton, we'll make sure you're not left holding the bag and you will be made whole. In other words, these billions of dollars that you feel you're owed will be taken care of somehow. What do you interpret that to mean?
So here's my worry right now. We've explained to the Premier the size of the costs. These are big numbers to build a police headquarters, a water treatment center, a wastewater center. And right now, the talking point in the province seems to be that, don't worry, Mississauga would not be able to run away on its bill. But when I hear Mayor Crombie speak, she says there is no bill. And so the reason I've expressed concern on behalf of my residents is I want to see a plan for this. The great Hazel McCallan always tell my residents, who over 50 years sweat and toiled and worked hard and contributed to the Region of Peel taxes to pay for this infrastructure that is critical. It's not infrastructure we don't depend upon, it is critical. Show me the plan. And as it stands today, I have not seen a plan for the province or the city of Mississauga how it will be paid for, but I get assurances from the province not to worry, will be made whole.
So I just need to jump in a little bit there, because Mississauga grew incredibly rapidly and grew first. Right? It started up at the water, and it's now going into Brampton, and Brampton is contributing to that, obviously. But Mississauga taxpayers and the developers who helped build Mississauga paid for Mississauga's infrastructure and helped contribute to the region's growth, right? So Mississauga contributed 60%, up to 70% for most years, right, of the region's growth, and had their local roads and services paid for by development charges, which Mayor McCallion invented before we had development charges across the province. And so now we have a province with Bill 23 pushing back on development charges, making it harder for municipalities to make themselves whole and pay for this future development that is happening and the infrastructure that is necessary to get all the houses that the province wants. And we're fighting over the scraps right now at this table, talking about, who's going to pay who for the services that already exist.
Can I get you to speak that, Mayor Brown? Because I think Mayor Crombie had an op-ed in the Toronto Star earlier this week in which he said, you've been able to freeze your budget tax increases 4 out of the last 5 years, in essence, building off the foundation of development charges that Mississauga has brought in over the years, that you've had that advantage. Is that a fair point?
So it's not a fair point in the sense that we have taken value for money audits very seriously. Brampton has had among the highest taxes in the GTA. When I became mayor, I said we need to get that under control. We still have higher taxes in Brampton than there is in Mississauga. So her notion that there's some tax luxury in Brampton that doesn't exist in Mississauga is factually incorrect. What I would say is, for what we have discretionary spending on, we've been careful the last few years, as we have to. In terms of, Alvin's comment about Bill 23, I hope that Bill 23 will not be used as a justification.
Better explain what that is for people who
so
don't follow
the
all
changes to development charges on Ontario, I hope Mississauga is not saying that's the impetus for wanting to walk away on the bill. This is a bill. There's no arguing that Brampton paid 40% of the water treatment and wastewater infrastructure and police headquarters in Mississauga. You can't run away on that bill. And it has to be replaced.
But the Premier has said he'll make you whole.
But the mayor of Mississauga is saying she doesn't have to. And that's my bone of contention. Alvin's singing a very different tune today. He's very collaborative, and I appreciate that. He's a very affable city councillor. But as the mayor of Brampton, I have to stand up for my residents. And when I hear the mayor of Mississauga saying she doesn't owe anything, that's alarming.
Well, do you care where the money comes from, if it comes from Mississauga or the province of Ontario, as long as you get it?
I just don't think this is Canada's Wonderland. I don't think the mayor of Mississauga is entitled to a free ride at the expense of Brampton taxpayers. Because if it comes from the provincial treasury, who's...
York region, there are a lot of similarities. There are a lot of comparable, they're very comparable with us.
Okay. Let me bring some brass knuckles politics into this, and that is, how many of the seats in Mississauga does Doug Ford's progressive conservative government currently have?
Yeah, 6 out of 6.
6 out of 6. In the city of Brampton, how many members of the Ontario legislature does Doug Ford's progressive conservative government already have?
5 out of 5.
5 out of 5. And your 1 seat?
1 out of 1.
1 out of 1. So the Tories have all the seats provincially that we're talking about here. Is the Premier, okay, Mayor Brown, you first, is the Premier in a very ticklish situation on this, in as much as what a tightrope he's walking to try and make sure he doesn't tick off his MPPs from Brampton or his MPPs from Mississauga or his Deputy Premier from Dufferin-Caledon. How does he do all that?
So I find the MPPs, and I know them personally, work very collaboratively together. I don't think he needs to worry about there being any type of divisions amongst his MPPs in Peel. I think the broader issue is how he's going to handle Mississauga wanting to be independent but not pay the bill. That's none of his MPPs are saying that. And so really it's how he handles Mayor Crombie's claim.
Okay, can I get you on that as well? Do you think there's a possibility that the MPPs, all of whom are in his caucus, are going to be problematic here?
I think there was a challenge when at one point we were talking about amalgamation and whether or not we should have a megacity. I think that would have been a lot of pushback from residents of both Mississauga and Brampton.
That's off the table, I assume now.
More or less, I think it's off the table now, now that we're talking about separation instead. But I think there was a lot of fear around amalgamation and looking at the city of Toronto and some of the challenges that they had and how their costs actually increased because all the salaries leveled up and the challenges with local representation and trying to get to your councillor and trying to deal with local issues was going to be dwarfed by this huge mega city of 1.5 million people overnight. And I think they heard that message loud and clear. The Conservatives did around that we're not acceptable of that as residents of Peel. But I think right now, we need to make sure that we're coming up with the best deal for all residents. And the province has come in and been very collaborative and said, this is going to be supervised, this is going to be negotiated. We are going to make sure that everyone is kept whole. We are going to make sure that the organizations that get set up outside of this at the local level and at the utility level will be done in a fair way to make sure that no one is going to have to pay more than their fair share.
Okay.
But that's what Mississauga has been asking for since 2005, as we've felt that we've been getting the short end.
I want to ask about savings, because every time I hear somebody say we should create a megacity, as they did in the city of Toronto, whatever it was, almost 25 years ago now, they always say, with this kind of consolidation, we'll get rid of all this duplicative planning departments and so on, we'll save at the end of the day. And it never happens. Mayor Brown, can you be sure that if you get to go out on your own, you'll actually have a leaner, meaner operation there?
Not necessarily. There was a study that the Region of Peel commissioned last term of council done by Deloitte that was exhaustive. and they said that the cost would go up for Mississauga, Brampton, and Caledon. And so, listen, the Ernst & Young one essentially is predicated, one that was the Mississauga requested, was predicated essentially on getting rid of all the employees. If you don't get rid of all the employees, it'll be difficult to have savings. Do I think we can work hard to try to find some savings? The example I articulated previously was on planning. You know, Elvin mentioned legal department. There are some areas that we can find savings, but I think we'd be naive to suggest it's simplistic. It isn't. It's going to be difficult.
What about in Mississauga?
Yeah, I mean, we're talking about duplicate levels of government, right? We're not just talking about multiple departments doing the same thing, which would be cost savings. Yes, there are going to be issues with people and what we do with people, and do we need the same number of people? There's a lot of planning happening right now. Everyone's looking for more planners, so I don't think there's necessarily an issue there. But we're also talking about a duplication of governance, right? I mean, Caledon is the largest area municipality in the GTA. Right, and when they need their roads approved, they need to come to the region with their hat in hand, asking for money for their roads. Right, we want to make sure that they have the ability to plan that themselves and not have to rely on the region of Peel and the priorities of Mississauga and Brampton in order to get that. And when we're talking about the challenges with homelessness and the affordability crisis, there are very different circumstances in each of these municipalities. Right, and when we're bringing those different challenges to a large table that has as many people and priorities as the region of Peel does, it doesn't work. We were arguing about mass transit station areas. We were arguing about, you know, who can develop first and faster, right? And people do things at different speeds, and so that's one of the challenges here. We need to fix the governance, we'll sort out the finances, and I think everyone's gonna be better off.
Well, I want to find that out about Caledon as well. Can you imagine operating more efficiently, a leaner operation, maybe a cheaper operation as part of York Region as opposed to part of Peel?
Well, I think that we certainly can. There are things that we can do. And again, we talked about the duplication. We don't need two planning departments. We do have a lot of regional roads. I'm not sure how York is going to feel about taking over a lot of those roads, but I think there are opportunities there to afford, to be able to run a leaner municipality with York Region. And again, I will go back in saying this, and I've been on record for years and years during these conversations about separation, is that the Region of Peel worked extremely well. Now, we will have to figure that out during the whole financial review and the audit on how we're going to do that. Where are we going to realize cost savings? How are we going to? Right now, Caledon will be on its own because the Premier has not made a commitment that we will be going to York Region. That's just us in Caledon saying, well, if we had to go somewhere, we would go to York Region. Now,
have you had a vote on that yet at council?
We have not. No, we have not. This is just conversations happening within the community. Now, you know, there's Dufferin as well. Can Dufferin afford Caledon? I don't think they can. They don't have the infrastructure in place to do that. York Region has a lot of the infrastructure in place that I think we would be okay with York.
Let me raise one more issue about, we got a few minutes left here, about politics here. And I'm curious as to how you ran for the Ontario Liberal leadership once upon a time against Stephen Del Duca in the last contest. And we hear that the mayor of your municipality is considering running for the Ontario Liberal leadership right now, which means that there's every possibility if she won, she'd be facing Doug Ford in the next election. And all of this is happening under the rubric of all of this kind of, you know, everybody whispering about it behind the scenes. How is all this going to affect all of these negotiations? Can you help us understand that?
Yeah, I mean, the separation argument is not a new one, as you mentioned, right? I mean, Mayor McCann talked about this in 2005. And the city of Mississauga likes to talk about, and rightfully so, how lean it's been over the last 15, 20 years. We've saved $77 million by being a lean corporation. And I think the mayor is quite proud of that. And like Mayor Brown has run for other office before. You know, I think that's the decision individually to Mayor Crombie to make on her own time.
But the question really is, can she negotiate on behalf of Mississauga with the Premier of Ontario? Can they actually do business knowing that both of them are thinking down the road that they may be facing off against each other in the next provincial election?
Well, I think they have been. I mean, we've been doing this over the last several weeks and months, and they've been negotiating the separation.
But her candidacy hasn't been as close to being announced as I suspect it is right now.
Well, they were very cordial.
They were actually.
Both talking
Yes, they were.
about the priorities of the region and trying to do what's best for residents. And I think both of them are mature enough and adult enough to be able to separate, an election in 2026 with what's in front of us right now. And that's the challenges that we have as a region.
Okay, let me ask Mayor Brown that, because you are the poster child for being big-time enemies with Doug Ford, and now you guys are best buddies. So this actually can work?
Well, I've got a very good relationship with the Premier now. 4 years ago, there was other actors involved that made that conversation more difficult. But, we have a very good relationship right now. We've got the new hospital deal done, a new medical school coming to Brampton, so a number of major wins. In terms of Mayor Crombie's candidacy, I don't think she's going to run. I thought that was more pushback against a potential megacity. I think now that there's no megacity, we're going to hear very shortly that she's not running.
Do you know something?
Well, that was the rumor in Peel Region. It was more of a threat about a megacity.
Well, as we often say at the end of this program, we shall see. I want to thank Alvin Tejo for coming in from the city of Mississauga, and then the two your worships on the other side of the table, Patrick Brown from Brampton, Annette Groves from Caledon. Thanks for having such a civilized discussion here, everybody, and good luck with the divorce.
Thank you.
Thanks, Steve.
According to the Canadian Institute for Health Information, the #1 reason for being admitted to hospital in Canada was to give birth. And as people across the healthcare system look for ways to ease the pressure, midwives say they can help if they're allowed to. With us now for more, Elizabeth Brandeis, registered midwife and senior project leader and labor relations specialist at the Association of Ontario Midwives, and Manavi Handa, professor in the midwifery education program at Toronto Metropolitan University and a registered midwife with West End Midwives here in Toronto. And it's great to have you two with us here. I have to start with this. I'm sorry, Elizabeth, I have to start with this. Why are you here?
Well, I'm here because my colleague Jasmine Texan, who's the president of the Association of Ontario Midwives, was not able to come because of a birth.
She was supposed to be here and
right.
literally this morning said, sorry, can't make it. I'm helping somebody give birth.
Exactly. But it's not unusual for a midwife to wake up in the morning not knowing how her day is going to go, and so that was me today.
All right, very good. Well, we're delighted that you're pinch hitting here, so that's great.
You.
Let's start with this. Manavi, midwife, doula, obstetrician, they're all involved. Different responsibilities, I assume, for all three. Can you help us understand that?
Very different responsibilities, a little bit of overlap. So doulas provide labor support. So they're there to help you emotionally, to help you with different positions, to rub your back, to help you kind of cope through the pain. Midwives also do that. Plus, we're responsible medically for everything that happens in a normal, low-risk birth, pregnancy, even if things become high risk.
That sounds like what a doctor does, though.
It is very similar. So we order all the tests that you would need in a normal pregnancy. We deliver the baby. We can stitch if we need to. We can cut if we need to. We would call a doctor in, so an obstetrician, and this is where that overlap is. They obviously also do normal delivery, but they are trained surgeons. And so we call an obstetrician in if someone needs a cesarean, if someone has a high-risk condition like high blood pressure or diabetes, then an obstetrician would get involved.
So fair to say, and I guess this is probably an expression I shouldn't use, but fair to say that if it's a quote-unquote routine birth, you're good to go.
We're good to go, and even a little bit outside routine, I would say.
A little bit outside. How difficult, Elizabeth, is it for somebody to get a midwife who wants a midwife to help with a birth?
Yeah, it's an excellent question. And currently in Ontario, about 4 out of 10 people who want a midwife aren't able to access them.
Are not able to.
Are not able to. So we have a supply issue in Ontario, meaning, we don't have the supply to meet the need for midwives. And as Manavi alluded to, midwives could be doing a lot more of the births in Ontario if the system allowed for that.
Why don't we have enough of them?
Well, the demand is there. So the demand is there. That's one big part. And because we have a healthcare system where we have many different players doing the same thing. So Manavi spoke of overlapping scopes of practice. Midwives' scope of practice overlaps with obstetricians for the normal, as you say, routine deliveries. Family physicians who do deliveries. Midwives also do much of the role of nurses and nurse practitioners. And so we really need a health human resource plan to kind of figure out what's the right mix of care providers in the system that makes sense for our healthcare system and that actually provides the care that childbearing people in Ontario want.
Right. Now, you're attached to a university. Do you not
Yes.
have a ton of people who want to get in and take these programs and become midwives?
We do.
So what's the problem?
The problem is there's only so many midwives to train other midwives. So one is we're a little bit of a limiting factor, and that we can only grow as quickly as we can have people
Teach.
to train midwives. The other factor is that I think even though there's a lot of demand, the general public doesn't necessarily know about midwifery. So questions like you have, like, what's a doula versus an OB versus a midwife? I think there's a lot of misconception out there about what midwives do and what they can do. And I think if we had students who understood more, we might have a larger pool. Now, having said that, a larger pool of students doesn't mean more graduates because there are still only so much of us. We could maximize what we do in the system by having more support in the system.
Let me also understand, are midwives there only outside hospital births? What's the ratio between how often you're either in hospital or out of hospital to assist in a birth?
That's one of the primary misconceptions that Manavi just spoke about. So midwives are primary care providers integrated into the healthcare system and really span the continuum of community-based care. So most midwives work in community-based clinics and then provide choice of birthplace. So that means that midwives are required to have hospital privileges, and about 75 to 80% of midwife-assisted deliveries happen in the hospital. There are 3 birth centers in Ontario, so that's an option in Toronto and Ottawa and at the Six Nations. And people who choose midwives can also choose home births. But one of the misconceptions is if you have a midwife, you can't birth in the hospital. And in fact, that's not true at all.
You can't. Now, if you're an OBGYN and you're performing a birth in a hospital, you've got an OHIP number, you send the bill to OHIP. Do you do that as well as a midwife?
Midwives are fully funded by the Ontario government. So we're funded through the primary healthcare branch. We don't bill through OHIP the same way that OBs do, but we're fully funded, fully publicly funded by the Ontario healthcare system.
Got it. But you do some births that are outside OHIP as well, right?
So my practice is the northwest corridor of the city, very high marginalized populations, and a fair number of people who actually don't have OHIP. So either...
Can I stop you there? Who
Why?
doesn't have OHIP?
So a surprisingly large number of people, either because they have precarious housing, mental health issues, addiction, and they just don't have papers, or, renew their papers on time, don't have safety to keep documents. There are a growing number of people that we call living with precarious status. So usually, like when my parents came, they had a work visa, they applied for a PR, they were able to stay, a permanent residency.
Okay.
They were able to stay. Now you can go from a work visa to applying for permanent residency and wait years in between for that application to be processed. So you fall out of status in
So you don't have
between.
health insurance?
So you don't have health insurance and you don't really have legal status.
Huh. And you help those people?
I help a lot of those people.
How do you do that? I mean, you got to get paid, right, for doing your work, so...
So because I am not fee for service, my care, like a community health center, is not tied to an OHIP card. It's tied to the resident of Ontario. So if you live here, I can take care of you. It doesn't matter what your documentation is. Whereas if I was a physician, then every single thing I do is associated with fee for service. And that's why physicians With a midwife, they can care for those clients because we have mechanisms for them to get paid if something becomes high risk. But they don't have mechanisms without a community health center or a midwife for an obstetrician, for example, to get paid.
One more follow-up. During the pandemic, the Ministry of Health expanded a lot of what it would cover because, like video conferencing with patients, that kind of thing, to make sure doctors got paid. Pandemic is not over, but it's more manageable now. Do those provisions remain, or what's the situation?
No. So March 31st was the last day of those provisions, which meant dozens and dozens, if not hundreds of people with care providers now don't have them for pregnancy. So everybody who's uninsured who had a care provider has pretty much been dropped by that provider. And now they're showing up. So I run a walk-in clinic for people who are uninsured. People are showing up in droves. Many people who need a C-section, who can't get a C-section even booked without paying thousands of dollars up front, which they don't have.
Which they don't have. Okay. Elizabeth, since we're talking turkey here, let's keep talking turkey. I don't know what an OBGYN gets to perform a natural child, like a routine delivery. But I bet you know how much you get. How much do you get for a routine delivery?
Yeah, it's a more complicated answer than kind of per delivery. Right. As Manavi said, we're paid for a full course of care. So that means when somebody comes into my office at maybe 8 weeks of pregnancy, I care for that person throughout the pregnancy, attend the delivery, take care of them and their newborn for 6 weeks after. That's one fee for that whole bundle of services. So the model of payment makes it difficult to say sort of exactly what the delivery is worth, so to speak, for a midwife. Yeah. But what we do know, and what was affirmed by the Human Rights Tribunal of Ontario, is that midwives are drastically underpaid compared to our comparator professions. So the Association of Ontario Midwives has been engaged in the last decade fighting for pay equity for midwives, and actually we had a landmark win at the Human Rights Tribunal that was announced in 2020 that's adjusted our pay to start to bridge that pay gap between midwives and our comparators.
How about this province versus other provinces? Are midwives better paid in other provinces?
Yeah, again, it's difficult to make that comparison because there are many different funding models. In some jurisdictions in Canada, midwives are employees. In some, they're paid as they provide, but then need to pay for their overhead. In a place like Ontario, midwives have compensation, plus a portion goes to benefits and a portion goes to overhead. So it's a bit difficult to kind of compare. Since the Human Rights Tribunal ordered a 20% increase on midwives' pay, we are commensurate to the highest paid midwives in the country at this point.
And the Human Rights Tribunal imposed that 20% increase. Did you in fact get it?
Yes, so we did.
The government didn't fight it.
So the government has dropped their appeal, so we're no longer fighting the argument around pay discrimination against midwives. That's been settled by 3 courts in Ontario now and did not have to go to the Supreme Court of Canada. But we know that a gap still remains. So one of the outstanding orders from the Human Rights Tribunal completely closed that gap through an evidence-based analysis of the skills, effort, responsibility, and working conditions of midwives. And so we expect that there will be a further adjustment once that study is complete and implemented.
And just so I'm totally clear here, is it your view that a midwife for a routine birth ought to be compensated the same as an OBGYN who does a routine birth?
No, that's not our claim. As we spoke about already, there's overlap in the scope of practice, but midwives have a different scope of practice than obstetricians. Really what our argument is that midwives should be paid based on their skills, effort, responsibility, and working conditions that are unique to midwifery. But because we're a female-dominated profession in the sphere of women's health, taking care of mostly women clients, we're subject to this, what we call a gender trifecta, and a penalty on our pay that actually discounts the work of midwives compared to male-dominated physicians.
You've anticipated my next question. Manavi, why don't I pick that up with you? I mean, we do see all over society lots of different sectors and lots of different professions and trades and jobs where women simply don't make as much.
With the government to prove that, proven in court.
So even now, female Minister of Health right now. So how come...
Even when you have strong women looking at doing now more than 20% of births, that occurs from government all the way down to hospital committees, where we forgot to add midwives onto this committee. And, you know, almost 30...
Do you feel you are qualified to do that you now can't do, either for a lack of respect or acknowledgement of whatever your skills, talents, and...
Yeah, I think there are two parts to that answer. So the first is, what is within currently our scope of practice that is hindered by outdated regulatory restrictions? And so one of the things that we've been advocating for is that we can order medications, but it's... So as we know in Ontario, pharmacists were recently granted new prescribing rights, able to prescribe for a variety of different ailments. And meanwhile, midwives have been asking for an expansion to the drug list that we're able, giving the COVID vaccine and flu vaccines to people who were coming into their offices. But because of those restrictions, we're limited in those ways. Tests, thyroid testing, because they're within our scope of practice. So that's one element. What does the Midwifery Act itself, the legislation that governs our scope of practice, how does that need to be updated? And there are things that midwives can and should be doing that are outside of what the legislation that was written in 1991 say, that would really make a difference in terms of playing a bigger role within the system. So that could be things like providing the full spectrum of reproductive care, not just for people who are pregnant, you know,
birth control pills.
Birth control pills around the world are within the jurisdiction of midwives from doing in Ontario, and we would like that to change.
You know what? I want to correct the record before I go any further. I think I said female finance minister. No, female president of the Treasury Board.
Yes.
But they control government spending. So anyway, I should just get that on the record.
I want to add one thing to that. So as an example, I provide expanded scope practice. So I insert IUDs that are hormonal. I can do an arm. All of those things are under an obstetrician's order. Even though I have the skills, the knowledge, the judgment, which is what I need, I don't have the legislation behind me. And so that means I need an obstetrician who knows me well enough, who trusts me enough, who, you know, is aware enough of my practice to be comfortable to sign off on me being able to do all those things when they're in my scope of practice, and I should be able to take the liability on my own.
So you really don't need the Yeah, well, I remember covering all this. This is more than 30 years ago. I mean, you've come a long way since then. It's commercial, but you have come a long way.
Where we have, like, I would say we have very good relationships for the most part, with our obstetric colleagues, with our nursing colleagues, and that was a few decades of figuring out how we work and where we overlap. So that way, I'd say we're really well integrated into the system. Obviously, different jurisdictions have their own political issues, but in general, we're very well integrated. And I think even our obstetric colleagues are like, what do you mean you need me to order this for you? Why can't you do this?
Okay, in our remaining moments then, Elizabeth, start us off with the next logical steps that you think the government of Ontario ought to take in order to get you where you want to go.
Yes, so immediate steps would be to expand midwives' prescribing rights to actually fit our scope of practice. Happen easily and should happen immediately. Lab testing, that's another thing. And then I think the other elements are, how can we be community responsive, as Manavi was describing, and provide the kinds of care that people in Ontario need. So contraception, abortion, reproductive care outside of pregnancy, those are obvious things that we know we have restricted access to around the province, and that could change with midwives filling into those positions. Care in the North and Indigenous communities is another area where midwifery can play a really important role.
And Laurentian just canceled its program.
Exactly. So that's one major impediment even further to an already underserviced area. There are incredible strides that are being made by Indigenous midwives providing culturally safe care to Indigenous communities. And that program just needs to grow, because we know that health disparities in Indigenous communities are unacceptable, and midwives can really make a difference in changing that picture.
Well, Manavi, you only get these things if you lobby the Minister of Health. Are you doing that?
Elizabeth?
Absolutely.
You're a tag team here?
Yeah.
Have you actually been in for a meeting with the minister?
So we've had issues. We're in direct communication with the Ministry of Health regularly around these issues. So we're really hoping that there's some traction and actual forward movement. Like I said, pharmacists were granted those increased prescribing rights. We want the same for midwives.
Gotcha. I want to thank the both of you for coming in and making us a lot smarter about this issue than we were 20 minutes ago. Elizabeth Brandeis from the Association of Ontario Midwives and Manavi Honda, Toronto Metropolitan University and the West End Midwives in Toronto. Thanks to both of you.
Thank you.
Steve.
And that is the agenda for Wednesday, May 17th, 2023. Pressure on both sides of the Mexican border continues to raise the stakes for all parties in the North American alliance. Tomorrow, why that's got some observers worried about next year's general election in Mexico. I'm Steve Paikin. Thanks for watching TVO, for joining us online at TVO.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism. Looking for more current affairs and documentaries? Visit tvo.org/newsletters to sign up for our daily newsletter with links to agenda interviews, read Steve Paikin's articles, and preview our upcoming documentaries. That's all at tvo.org/newsletters.